This presentation is for the nursing course 2522 at York University for the second degree entry program. It will consist of a brief overview about hemorrhagic stroke. To start off, some important things to consider is that stroke is a medical emergency, and hemorrhagic stroke can be more devastating and generally lead to poorer outcomes the longer time passes. So hemorrhagic stroke patients should be quickly transferred and monitored in the intensive care unit for further assessment and treatment. The hemorrhagic stroke occurs when blood leaks into the skull cavity, causing two complications. First, blood is lost and there is decreased pressure to deliver blood to the outside or peripheral brain tissues, which limits oxygen and nutrients, causing tissue damage or death. And two, because the skull is a closed system, the addition of blood causes an increased pressure, which may compress the brain. One of the two most common causes for the leaking of blood in the brain may be from berry or saccular aneurysms. The berry aneurysm occurs when a weakened blood vessel creates sacs that look like berries on an area along the blood vessel. The sac may burst spontaneously or from trauma. Weakened arterial walls may be genetic or be from prolonged hypertension that puts stress on the walls. A second cause is arteriovenous malformation, also known as AVM, in which high pressure within blood vessels increases the risk of rupture. In a normal arteriovenous system, as the artery makes its way to the capillaries, the pressure decreases, and this decreased pressure is maintained as the blood moves into the veins. However, in AVM, there is no decrease in pressure as the blood moves into the veins because of a defect in blood vessel formation during development, thus causing an increased risk of rupture. The signs and symptoms that are related to hemorrhagic stroke are generally dependent on the location and size of the stroke, which might cause unilateral paralysis and speech problems, nausea and vomiting, swallowing problems, or decreased level of consciousness. However, a sudden onset of a severe headache, described as the worst headache of their life, is most often present in patients with hemorrhagic strokes. The complications that may arise are also largely dependent on the area and size of the stroke, and includes difficulty swallowing or talking, blood clotting, memory loss, brain swelling, seizures, coma, and even death. The diagnostic procedures and tests involve three major types: the health history and physical assessment, laboratory results, and imaging tests. During health history, questions such as the occurrence of previous strokes, hypertension, and medications taken, such as anticoagulants as they decrease clot formation, are important to note. For physical examination, neurological assessment should be taken. Lab tests should look at electrolyte levels and toxicology screens used to rule out other possibilities that may cause stroke-like symptoms, such as heart or kidney problems. Lab values are also used to check CBC, especially red blood cells and platelets, and coagulation studies looking at PTT and PT for clotting time, as low levels of these two categories indicates an increased risk of hemorrhagic stroke. For imaging tests, CT scans and MRIs are the first line of diagnostic tools used to differentiate between ischemic and hemorrhagic strokes. For treatment, surgeries are to stop the bleeding, which can be in the form of closing the ruptured aneurysm or decompression of the brain to release blood and pressure. For the aneurysm clipping, this involves clipping the base of the aneurysm to stop the bleeding. For coil embolization, this involves pushing wire into the aneurysm to allow the blood to adhere and to clot to the coil that is inserted, blocking the blood from leaving. To decrease pressure in the brain, the burr hole procedure can be used, which involves drilling a hole in the skull. A craniectomy incision and the craniotomy are both used to open the skull cavity to allow the brain to expand and not be compressed. Some nursing interventions that are involved include monitoring vital signs, especially blood pressure, managing symptoms by medication administration of antihypertensive to decrease blood pressure, since during a hemorrhage the heart pumps harder, thinking that this will help reach peripheral brain areas better. Avoid or stop taking warfarin or aspirin as this increases bleeding. Anticonvulsants are considered since when the brain is compressed, this disrupts electrical activity, which can lead to seizures. And antidepressants are also considered because something known as post-stroke depression. After surgery, the nurse should be aware to assess site of surgery for infection and for proper healing, to administer frequent neurological assessments, to be aware of neurological changes as early as possible, to prevent aspirations and support the airway, breathing, and circulation, to promote adequate nutrition, to educate and communicate with patients and their family in coping, teaching signs and symptoms of stroke in the case of reoccurrence, and managing risk factors for stroke to lower potential causes of risks, such as hypertension or diabetes. And finally, the nurse should ensure physical therapy, occupational therapy, and speech therapy are ordered as needed, as rehabilitation is important for long-term treatment and recovery.